Welcome to this special interview with Dr. Leong, where we delve into the personal and philosophical side of medicine. Today, we have the privilege of speaking with a distinguished doctor who has not only dedicated her life to healing, but also offers unique perspective on the values and principles that guide her work. Join me as we explore the human side of medicine and we get to know the person behind the white coat. So, what inspired you to pursue a career in plastic surgery, and how has it shaped your life and your personal values?
To be honest, I fell into plastic surgery. I know that's not something you typically hear from a plastic surgeon because we have huge egos, let me tell you. But I fell into plastic surgery. I have no regrets. I love everything about what I do. I love the fact that plastic means fluid. That means I can use my creativity, I can use my imagination, but that means I also interact with my patients at every touch point of their lives. It's a journey. I work with children, I work with mothers, I work with grandparents, and the reason I think I love what I do and the way that it has really affected my life choices is that each individual is individual. And the way that we treat them is targeted to each person's needs. It's a journey. That's what I tell them. From start to finish, it's a journey. And I hope we're in it together.
Outside of your profession, what hobbies or interests do you pursue that contribute to your overall well-being and influence your approach to life and work?
This year, I have to tell you, it's been a little stressful, and mindfulness and making work-life balance for me has been a top priority. Things that I really enjoy, I do obstacle races. I do Spartan and Tough Mudders. I love the challenge. I love the physicality of it, and I'm good at it. I'm competitive. That's part of the nature of plastic surgeons. We want to be number one. So I like doing that. I am also a mother. I have a 4-year-old daughter. She takes up a lot of my time. Part of what I really appreciate about being a full-time working professional is that when I'm at home, I'm at home. I like to turn it off, but when I'm at work, it's an escape. I love my daughter, but I love my work too. So that helps me to balance. What else do I love to do? I cook. I like cooking for people. I find that it's a de-stressor in my life. We have people over for dinner and they say, how can you take the time to make all of this? But for me, it's a passion and it's an outlet. Again, with plastics, it's being creative, it's being imaginative. And cooking for me is similar. There's a lot of flavors, there's a lot of spices, and there's a lot of different things that you can do with these combinations. I wind down my day by reading. I am an avid reader. My husband will tell you, as soon as I lock my eyes on a book, it's like nothing else exists. But that lets me turn my brain off at the end of the day, and it lets me rest so that I can start again, refreshed.
What aspects of your work as a plastic surgeon bring you the greatest fulfillment, and how do you stay motivated to continually provide exceptional care?
It's all about patient care. What I value most about my practice is my connection, my relationship with my patients. I love being able to consult with them and feeling that we have reached a mutual agreement on what they desire, what their goals are. And I love being able to nurture those desires into reality. But I also appreciate the fact that our relationship goes beyond just surgery or just treatments. Don't get me wrong, I love being in the OR. Every surgeon does. But at the end of the day, it's our ability to provide exceptional patient care that really motivates me. The other thing I do is I do charitable work. I do volunteer plastic surgery for a foundation that I'm a lead surgeon at. And that gives me satisfaction and the ability to give back to a community that doesn't necessarily have access to care. So while I consider myself an aesthetic plastic surgeon, I do give back to my community, and that's really important. That keeps me balanced.
What insights and values have you gained that have had a significant impact on you as an individual?
What I do is not easy. The surgery part is easy. the interaction, the counseling, the building of the bond, that trust factor, that's not easy. And I think oftentimes you come across clinicians, doctors, who really shouldn't be interacting with people. But you can't have a plastic surgeon who's not good with people. And I am by nature an introvert. I would rather be holed up with a book, don't bother me. But my profession and my passion as a surgeon requires me to step outside of myself. So that's the biggest insight I've had over the last couple of years. I can be this person, but I'm also a quiet little person.
In your opinion, what are the most important qualities, both personally and professionally, for a plastic surgeon to possess in order to provide compassionate care and achieve successful outcomes?
I think first and foremost, and at the foundation of all relationships, is trust. If my patient and I cannot establish trust, there's really no way for us to move forward. And I hope that I've achieved enough wisdom in my little bitty baby career that I'm able to say, hey, maybe we're not a good match. Plastic surgeons have to be very patient, but a little bit immovable. A lot of what we do hinges on listening well. I need to hear what you're not saying. I can't just look at you and make my assessment. You're going to see a lot of women who've had breast augmentations and come back and say, my surgeon didn't listen to me. They're too big. I told him or her I didn't want to be this big. So we need to hear the patient's desires over our own. And that's a difficult skill to learn. Like I mentioned before, surgeons have big egos. We think we're always right. But in plastics, that's secondary. It's not important.
What are some common concerns or reservations that patients may have when considering plastic surgery, and how do you address these to ensure their comfort and their trust in your practice?
That's a great question. In this area, plastic surgery is very common. Maybe not as common as in, South Korea or Beverly Hills, but pretty common. But the aesthetic here is also natural. People want to look done without looking done. They don't want obvious scars. They don't want obvious anything. They want to walk out and have people tell them they look amazing and never say a word. Now, that's not really good for business, but it makes them happy. The hardest part of what I do is trying to establish what that means, because your version of natural and my version of natural may not be the same thing. So I need to listen to you. I need to hear what you're saying, and then we need to work together to try to achieve that goal. And it's not always easy.
Effective communication and building trust are essential in the doctor-patient relationship. What do you believe are the key skills and approaches for fostering open and honest communication with your patients and their families?
I think, again, we go back to trust. If we don't trust each other, and it is a two-way street, it can't just be, oh, I trust you, doctor, but then I don't trust that they're trusting me. That's a huge communication gap. We do our best here in this office to offer exceptional care. We want to care about you at every level, not just for your procedure, not just for your skin concern, but about your family, about your mental health. There's a lot of counseling in plastic surgery. Honesty is vital. Not everyone is honest when they walk into the office. I mean, I can ask you, do you drink alcohol? And you'll tell me, oh, socially. But what does socially mean? It's different for everyone, right? And everyone always downplays what they actually do. And it's the same thing with surgery. People downplay their concerns. When they have concerns after surgery, they downplay their desires, whether to be more natural or less natural. A lot of times people tell you what they think you want to hear. And part of my job, even though I know I'm wearing the white coat, is to make them comfortable enough to tell me what they really think and what they really feel. My staff and I, we prioritize that. We make notes about our patients, about their different concerns, about their social situations. We try to remember these things. I think doing that makes them feel cared for, and that's what we want. We want that nurturing, we want that family. When they walk in the door, we know their names, we greet them by name. These are the things that are important to us. These are the things that we promote in our practice. And it goes from the moment you enter the door through all of your consultation, your treatment, post-surgery, every step of the way, you're never alone, and we're always there to listen and to care. Oftentimes, patients will come in alone for their consultations or their post-op visits when this is a full family affair because it affects families at different levels. Say, for instance, a woman who comes for a mommy makeover who has young children at home. It involves the caregivers, it involves her spouse, it involves the children. A lot of the times when they come in and they have these concerns, I say, bring your spouse in. Let us meet your kids. Let us help you by bonding with them, you know. It's difficult for patients sometimes to understand that they have to bring everyone into the fold. And yes, while it's true, this is your body and it's your choice what to do with it, and no one should try to make you make a decision you're not comfortable with. But at the end of the day, like they say, it takes a village. And with surgery and recovery, it really does take a village. When we talk to families, when we talk to individuals, when we have that trust among all the different family members, it really helps our practice to move forward. And it helps us to engage the patients, engage their families, and then they keep coming back. And that's really what we're about. We're about the journey. We want to continue. It's not just a one-touch stop. We want you with us forever.
How do you see the field of plastic surgery evolving and changing in the future? And how are you actively preparing for these advancements to ensure you continue delivering the highest quality of care for your patients?
That's a great question. I think as a physician, not just a plastic surgeon, we have a little bit of anxiety about being replaced by AI. Are we essential? Does the human touch matter? Plastic surgery, absolutely. It's one of the rare fields, I think, at least surgically, where you don't see a lot of robotics. You don't see a lot of technology. It's still our hands on our patients on the table. I'm not a country away playing a little video game controller and working on you because that human connection is more important than anything. The other thing is plastic surgeons, I think plastic surgery as a field, because it developed as a military medicine, it evolved on the field, it takes a lot of creativity. And you can't necessarily train a robot to be creative in every situation. Absolutely, they can do by rote things. I understand that. I like that. But for us, it takes a little bit more. And I think only a human can do that.
Thank you so much for joining us today and sharing your personal experiences and insights with us. It is so refreshing to speak to such a compassionate and honest doctor in this field. And we wish you all the best in your continued efforts to make a positive impact on the world.
Thank you. That's so kind.
Let us all take a moment to reflect on the values and principles that guide us in our own lives and the impact that we have on the world around us. Until next time, this has been a special interview on the human side of medicine.